Now, how can the country further intensify this COVID-19 detection? Joining us now is Thomas Navasero, founder of the private testing company LabX. Tom, thank you so much for joining us. Before we went on air, you shared with us that you now have COVID. And we really appreciate your accommodating us tonight, being in isolation. Share with us, what are you feeling right now?
Good evening, Rico. Yes, typical symptoms, body aches, fever, dry cough. But I still have my sense of smell and taste, which is unique to this second case of COVID with me. I've been monitoring my SpO2, but it's a little on the low side at 90%, and temperature at about 100, 101 degrees Fahrenheit. So I'm still good. I'm self-isolated, and I'm lucky I was able to test myself for COVID before stepping out of the house.
So how are you managing now that you have COVID-19? Are you taking any kind of medication?
No, Rico. I just take my fluids. I boost up my vitamin C, and lots of rest is key. No drugs. I'm not that stage, but I may have to bring in an oxygen tank to make sure that I have a good oxygen flow in my blood.
Why no medication, not even a paracetamol at this point?
Well, I as an engineer and scientist, fever is a weapon of our body against any viral or bacterial presence. So I allow my body to fight it and inactivate the virus with heat.
Mm-hmm. And you own a testing firm, a private testing firm. How often should you have yourself tested and find out if you're positive or negative for COVID infection?
Well, in our firm, we test every week, every Monday. And also because of this new spread this last 2 weeks, we've upped our testing to basically every Monday and Thursday with our staff. As for me, I test daily. And because of testing daily, when one feels a slight symptom of a cough or fever or a headache, I can basically prevent spreading the disease by testing early.
Would you know, Tom, where you got infected?
I'm sorry?
Tom, would you know where you got infected with COVID-19?
Yes, I do know, and I do know how. So I train for the Ironman Philippines, and so in my running, I sometimes lower my mask to breathe, and that was a mistake. And so I picked it up in a crowded running area on the streets.
And you know what, Tom, this is the second time you got COVID. We spoke to you last year, and you had the original variant. How different are the symptoms then from the one that you have now?
My symptoms last year, November, basically is very similar to my symptoms today, except for the loss of smell and taste. This virus or variant or COVID infection I have today, basically I still have my sense of smell and taste. And this can be basically related to the proteins, right? These viruses have proteins, and a mutated or variant virus has different proteins. So and these proteins will create different symptoms for each individual. So now I can see that these are two different, I can sense that these are two different variants.
Please take care of yourself, Tom. I mean, these are very difficult and challenging times. Now let's get into, I hope you don't mind, into testing. You earlier heard testing czar Vince Dizon, 50,000 tests per day. And lawmakers want massive testing. Not enough testing, they say, is being undertaken by the government. In your view, is this enough in the current situation that we have?
First, I want to congratulate Vince in getting the numbers from 1,000 to 50,000. Remember the early days, we were only doing about 1,000 tests per day, and that was only RITM with the PCR. Today, 50,000 PCR tests is an amazing feat, but it really is not enough, Rico. And yes, the lawmakers are correct. There is a need for more testing, but the key here is not just the amount of testing, Rico. It's early testing and how we test. I'm recommending that we must empower our fellow Filipinos to test at home, to test in their offices on a regular basis, and to ensure that our borders, prior to boarding a bus, a train, or a plane, we must test.
But if they have to do it at home and they also have to do it in the workplace, should it just be RT-PCR, saliva test? Should it be a combination together with antigen testing? By how much more should the government ramp up testing? I mean, which is currently at 50,000 per day. Should it even surge to like maybe 75 or 100,000 a day to be able to find out where we're at in terms of infections and these new variants?
I think the focus here is to make sure that each and every Filipino, before they step out to visit a friend, to go to work, they must find a way to test themselves. Now, look at the US, look at Europe. Home testing, simple, low-cost antigen tests are now being mass-produced in these countries to allow the Americans and Europeans to be able to test themselves before stepping out. There are many solutions in that space, and I know that the US FDA has already approved over 4 different home use tests. Here in the Philippines, we have had to adapt to the FDA rulings that each and every antigen test must be administered by a health professional. So what we did was we developed a home use test, not a self-test, but a home use test where you can basically connect with a nurse, we call it telenurse or teletest, to ensure that the process of testing is done and administered by a health professional. This way, we can make sure before we step out from our homes, we're not spreading. And I hope if we continue doing this in a more large-scale path, then we can truly stop the spread and stop the pandemic.
And Tom, being infected with COVID now twice and while waiting for the public to be vaccinated, what lessons can be learned as our kababayans continue to work and go out to make a living despite the rising number of cases?
I think one thing is we must really take responsibility to ourselves. Let's monitor our own symptoms. So before we step out, let's make sure we do a check. Are we breathing okay? Do we have fever? Do we have headache? Do we have body pains? Do we have runny nose? Do we have a dry cough? If any of those symptoms are present, please stay home. And hopefully one day we can all get vaccinated.
Thomas Navasero, please take care and get well soon. He is a biomedical engineer and LabX founder.